Hi, I'm Beth Campbell-Duke. I'm a spousal care partner for my husband who has experienced a delayed diagnosis while he was in the hospital. It has had a lasting impact on his health and both of our lives. After being knocked off his Vespa by a careless driver, Tony was diagnosed with a significant number of bone fractures. He was admitted to hospital, and because he is a lung transplant recipient, he was moved from Victoria, where we live, to the hospital in Vancouver, where he had his transplant a few years ago. The bone fractures, however, weren't the extent of his injuries. Tony had a perforated bowel that was missed because these types of soft tissue injuries can develop in the days after the trauma. The resulting sepsis wasn't diagnosed until he underwent exploratory surgery. His condition was severe, and he aspirated into his transplanted lungs. That injury required him to be on ECMO, specialized heart-lung bypass equipment that oxygenates your blood when your lungs are unable to. We're lucky he survived, as the mortality rate for sepsis is between 30 to 40%. After 6 weeks, he left the hospital with an ileostomy that has required 2 follow-up surgeries to correct. Physically, he is left with ongoing pain, issues with walking, cognitive changes that include memory and word retrieval issues. Mentally, we are still working on recovering, in no small part because the error has gone unacknowledged and there is seemingly nobody on his medical teams who are willing to address his brain injury. Despite being in a high-risk group for sepsis due to his anti-rejection medication, the signs were missed. I didn't know the 10 common signs of the declining patient, but I struggled to live with the fact that when I did note some changes and reported them, I wasn't forceful enough, and that delayed his care another 12 hours. What we've learned from this experience is that not only do you need to advocate for yourself, you really do need to have someone to advocate with and for you whenever you are hospitalized. And it's best if both the patient and care partner have access to resources before hospitalization. Patients for Patient Safety Canada has resources and links to resources of other organizations on their website, patientsforsafety.ca. That's patients, number 4, safety.ca.